So, hello students, and let us in this lecture discuss about the important topics of neuroanatomy. बच्चों को हमेशा डर लगता है न्यूरोएनाटॉमी का. It's a big topic, it's a big portion, lot of things to be read, but उसमें भी important topics you should know. तो उसका लिस्ट मैंने आपके लिए बनाया है. Students, watch this video till the end so that you get a complete idea about the topics that you have to read, the topics that you have to cover. Okay, so coming to the list of important topics of neuroanatomy, starting with the SAQs first. SAQs पहले discuss करते हैं अपन या फिर पहले LAQs देखते हैं. LAQs पहले discuss करते हैं. So what happens, you know students, एक LAQ अगर आप बनाते हो so automatically 3-4 SAQs तो हो ही जाते हैं, है ना? So coming to the first LAQ, understand the superolateral surface of the brain, the functional areas and the blood supply. A very favorite question of the examiners. हमेशा पूछते हैं. कुछ नहीं तो superolateral surface तो आता ही है. तो you have to draw a beautiful diagram of the superolateral surface. Easy है. The various sulci, gyri draw करना है, लिखना भी है. वैसे है ना, superolateral surface का question, the answer length is small, so you have to increase the length of the answer, right? So you have to write about the sulci, you have to write about the gyri on the superolateral surface. फिर functional areas के बारे में लिखना है, हाँ? The primary areas, the association areas of frontal lobe, temporal lobe, occipital lobe and the parietal lobe. The primary sensory area, the primary motor, the supplementary areas, सब लिखना है आपको, हाँ? You have to write about the uncinate fasciculus which connects the Broca's and the Wernicke's area. And फिर blood supply of the superolateral surface, only superolateral surface का blood supply. ये problem क्या होता है ना, students blood supply देखते हैं and they describe the blood supply of the entire brain. उतना टाइम ही नहीं है अपने पास. So blood supply of only the superolateral surface. So you have to draw the middle cerebral artery which supplies a major part of the superolateral surface. A small part on the superior surface is supplied by anterior cerebral, and temporal lobe and the occipital lobe which is supplied by posterior cerebral. ठीक है, ये इतना आंसर होता है. वैसे एक MCQ हमेशा आता है, blood supply of the motor area or the sensory area. What do you say, students? It is yes, MCA plus ACA. बच्चे लिखते हैं middle cerebral artery. No, it's middle cerebral artery which supplies the major part, and a small part on the superolateral surface ऊपर is supplied by anterior cerebral artery. So blood supply of the motor or the sensory area, it's ACA plus MCA. याद रखना. And blood supply of the occipital lobe, क्या बोलते हो? This is a very commonly asked MCQ. Blood supply of the occipital lobe. Students write it as posterior cerebral artery. Yes, posterior cerebral artery तो है ही. In addition, there's a middle cerebral artery which supplies the macula, right? So blood supply of the occipital lobe, two arteries, posterior and the middle cerebral artery. That is what you have to write. That is why अगर posterior cerebral artery का thrombosis होता है, so there is blindness with macular sparing. Yeah, blindness with macular sparing. Fine. So this is what you have to write. Then you have to write about the clinical भी लिख सकते हो ना, clinical applications भी लिख सकते हो. What is aphasia, huh? Right? What is sensory aphasia? What is motor aphasia? Okay, fine. Now coming to the next, white matter of the CNS and internal capsule. अब इसमें ना you have to write about the various white matter of the CNS. What are those? White matter में enumerate the white matter of the CNS and describe the internal capsule. तो उसमें आपको लिखना है projection fibers, association fibers, commissural fibers के बारे में लिखना है. Examples, you have to write what is projection, commissural, association fibers, and you have to write the examples of which. ये सब MCQs में भी आता है. This also asked in MCQs. हाँ, projection fibers, commissural fibers, association fibers. Association का example is uncinate or the arcuate fasciculus. Perfect है? Fine. And then internal capsule you have to write. You have to draw that horizontal section of the brain. You have to draw the internal capsule with the caudate nucleus and thalamus on the medial side, the lentiform nucleus on the lateral side. फिर उसके parts लिखने हैं, anterior limb, genu, posterior limb, retro and sublentiform part. And the fibers passing through this, the ascending and descending fibers passing through the various limbs of the internal capsule, you have to write. And you have to write about हेमिप्लीजिया, है ना. इंटरनल कैप्सूल का ब्लड सप्लाई लॉस होता है. When there's thrombosis of an artery supplying the brain, there's loss of blood supply to the internal capsule, and that leads to hemiplegia because of the concentration of the fibers. Corona, ठीक है, fine, clear है, कुछ doubts है? Okay, great. Now coming to the cerebellum. So cerebellum normally नहीं आता है, but suppose if it comes. Write about the various surfaces of the cerebellum, the superior surface, the inferior surface. Write about the fissures, the primary fissure, the second, the horizontal fissure, and the posterolateral fissure के बारे में. Write about the vermis. Write about the cerebellar hemispheres. Vermis and the cerebellar hemispheres के बारे में लिखिए. And then write about the various nuclei of the cerebellum, the dentate, the nucleus globus, the nucleus fastigiae, the nucleus emboliformis, and the connections of the nucleus you can write. You can write about the archicerebellum, the neocerebellum, the pallicerebellum. इसके बारे में लिख सकते हो. And then you have to write about the various cerebellar peduncles, the superior, middle, inferior cerebellar peduncle, and what are the fibers which are passing through these peduncles. That is very important. ये MCQ में भी आता है, fibers passing to the various cerebellar peduncles. And फिर उसका clinical application आप लिख सकते हो. What are tremors? What are intentional tremors? What is dysdiadokinesia? Loss of supination, pronation. Then slurred speech. All those lesions of the cerebellum, blood supply of the cerebellum. You have to write the superior cerebellar artery, the anterior, inferior, and the posterior, inferior cerebellar artery. ठीक है, उसके बारे में आपको लिखना है. Then बच्चों, cranial nerves. Cranial nerves, this are the cranial nerves which are asked as LAQ. वैसे 3, 4, 6 भी पूछ सकते हैं, but 3, 4, 6 is generally an SAQ. 7, 9 and 12 cranial nerves generally always asked. तो उसके पहले तो functional components आपको लिखना है cranial nerves के. Then you have to write about the nuclei of the cranial nerves. Where is the nucleus located? वो diagram draw करना है. Then you have to write about the intracranial course attachment to the brainstem. तो cranial nerves कैसे लिखोगे? Number 1, functional components. Number 2 is the various nuclei. Number 3 is the intraneural course inside the brain. Number 4, attachment to the brainstem. मतलब कहाँ पे attached है? या mid brain में, या pons में, या medulla में. Medulla में है तो between the pyramids and olus, or between the olus and inferior cerebellar peduncle. So that is the attachment to the brainstem. फिर उसका intracranial course, which foramen does it exit through? तो वो हो गया उसका intracranial course. And finally comes the extracranial course. मतलब from the skull, exit from the skull to the effector organ. वो जो course है वो extracranial course हो गया. ठीक है बच्चों? तो क्या क्या लिखोगे? Number 1, functional components, very important. Number 2 is the nuclei and उसका locations. Number 3 is intraneural course. Number 4 is attachment to the brainstem. Number 5 is intracranial course, and then finally extracranial course, and last is clinicals, muscle supplied and clinicals. So that's for any cranial nerve. ये है ना, ये एक skeleton याद रखना, and just answer to that points, right? So 7th nerve, facial nerve का course वगैरह ear में, उसका course in the ear and all that you have to know. 9th cranial nerve, how it goes between the superior and the middle constrictors, how it enters that mouth, it supplies the tongue. And the 12th nerve, वो कैसे hypoglossal nerve tongue को supply करती है. Fine. And blood supply of the brain. अब अगर blood supply of the brain आता है तो उसमें you have to write about the arterial supply. You have to write about the circle of Willis कैसे form होता है, the various branches of the internal carotid artery and the various branches of basilar artery. फिर circle of Willis का formation, you can write about the interpeduncular fossa. Then you have to write about the blood supply of the superolateral surface, medial surface, inferior surface. तो ये हो गया arterial supply. Arterial supply, circle of Willis and the arterial supply of the various surfaces of brain. Then comes the venous drainage. Venous drainage में आपको लिखना है, yes, the superficial veins, the deep veins. What is how the basal vein is formed? Superficial veins में, deep veins में, how is the great cerebral vein of Galen formed? And the great cerebral vein of Galen drains into straight sinus. तो ये पूरा veins के बारे में लिखना है. This comes as a MCQ also. The basal vein, the great cerebral vein of Galen, ये सब याद रखना. So this limited LAQs है बच्चों. Brain में neuroanatomy में limited LAQs हैं. बस इतना पढ़ लो, it will be very clear. It will be very easy to answer. Fine. Then SAQs again. Corpus callosum is a very important SAQ. उसके parts लिखने आपको, उसका type of fibers, commissural fibers. Then you have to write about the rostrum, genu, trunk and splenium. And then you have to write about the relations of the corpus callosum. And अगर corpus callosum affect होता है, then there's a the half of the body doesn't know what the other half is doing. Normally एक half knows what the other half is doing. That is because of the corpus callosum. अगर इसका lesion होता है, so that orientation is lost of the opposite half of body. Fine. Circle of Willis, how it is formed, that you have to write, where it is located, the interpeduncular fossa के बारे में लिखना है. Venous drainage of brain, just now LAQ आपने prepare किया तो SAQ भी आपको पता है. Venous drainage में superficial veins, deep veins, the great cerebral vein of Galen के बारे में लिखना है. The basal vein के बारे में आपको लिखना है. I've explained all this in my lectures देख लो. Interpeduncular fossa lies at the base of the brain. उसके boundaries आपको लिखने हैं. Anterolateral is the crus cerebri. Anterolateral is, yes, the optic tract. Yes, and posterolateral is the crus cerebri. How is the floor formed? And the contents of the interpeduncular fossa, the circle of Willis, and the third nerve. Yes. Then you have to write about the third, you have to know the third ventricle. Third ventricle ke relations, the lateral wall, anterior, posterior, roof, floor, the communications of the third ventricle. That you have to know. Lateral ventricle ke bhi parts you have to know. Anterior horn, body, posterior horn, inferior horn, uske relations of the lateral ventricle, what is foramen of Monro, and how is the CSF flowing. And finally, fourth ventricle. Fourth ventricle, though, you have to know. Fourth ventricle is very important, bacha. Fourth ventricle is very important. Fourth ventricle, though, वैसे भी आता ही है. Generally आता ही या फिर diagram of the fourth ventricle आता है. So, where is the fourth ventricle located? In the lower half of the pons and upper half of the medulla. उसका floor कैसे बनता है? What is median sulcus, limiting sulcus, median eminence? What is stria medullaris? पॉन्स में क्या मिलता है? फेशियल कॉलिकुलस. मेडुला में क्या मिलता है? हाइपोग्लॉसल ट्रायंगल, वेगल ट्रायंगल. ये कैसे फॉर्म होते हैं? दैट यू हैव टू राइट. यू हैव टू ड्रॉ दिस सेक्शंस ऑफ द ब्रेन स्टेम. ओके. देन रूफ यू हैव टू राइट द सुपीरियर मेडुलरी वेलम, द इंफीरियर मेडुलरी वेलम, एंड फाइनली द कम्युनिकेशंस ऑफ द फोर्थ वेंट्रिकल, द फोरामेन ऑफ मैजेंडी, द फोरामेन ऑफ लुश्का, राइट, एंड द फ्लो ऑफ CSF. That's about the fourth ventricle. The facial colliculus कैसे बनता है? It is formed by the fibers of facial nerve as they wind around the abducens nucleus. The fibers of facial nerve, they form the facial colliculus, and the nucleus beneath the facial colliculus is abducens nucleus. Fine. Then TS of brainstem. बच्चे TS of brainstem ये हमेशा प्रॉब्लम होता है बच्चों को, बट important points, important उसमें याद रखना. Not everything is important. TS में important structures you remember. मेरे lectures में I have told you how to remember those important things. So TS of brainstem and the various syndromes. Various syndromes में medulla में medial lateral medullary syndrome याद रखना है. That's very important. Pons में Millard-Gubler syndrome. Yes. And midbrain में Weber syndrome and Benedict syndrome, if you remember. But Weber syndrome is a must. इसके clinical MCQs भी आते हैं. इसके clinical questions भी आते हैं. On the brainstem lesions. Very important, very important. फिर peduncles, we've just discussed this. Peduncles, superior, middle, inferior, cerebellar peduncles के बारे में आपको लिखना है. And the various fibers passing through the peduncles. Fibers passing. This you have to know. ये MCQs में भी आता है peduncles. फिर blood brain barrier, blood CSF barrier. This comes in MCQs. या फिर ये वाइवास में पूछते हैं. What is blood brain barrier? What is blood CSF barrier? This you have to know. Third, fourth and sixth cranial nerves. उसका same. Cranial nerve का I've told you what all points you have to remember, but ये short में लिखना है. It's a short note. So short में लिखना है. उसका relations through the cavernous sinus, उसका exit through the superior orbital fissure, the common tendinous ring के बारे में आपको लिखना है, and then what it supplies. 3, 4, 6 nerves, and उसका clinical relations, clinical applications. Its relation to the cavernous sinus. So cavernous sinus thrombosis में क्या होता है? Right. Then third, fourth, sixth cranial nerves ये हो गया. फिर nucleus of the thalamus. Various nucleus, if you can remember, ये generally नहीं आता है, but even if you have read physiology, no, तो फिजियोलॉजी का पार्ट भी लिख सकते हो. सी फिजियोलॉजी एंड एनाटॉमी गो हैंड इन हैंड. तो न्यूरो एनाटॉमी न्यूरो फिजियोलॉजी साथ में पढ़ना, इट विल बी इजी फॉर यू. एंड फाइनली स्पाइनल कॉर्ड का व्हाइट मैटर ग्रे मैटर याद रखना, द रेक्सिड्स लैमिना, द वेरियस न्यूक्लियाई इन द रेक्सिड्स लैमिना याद रखना, एंड द लीशंस ऑफ स्पाइनल कॉर्ड, राइट. टेबिस डॉर्सालिस, हेमिसेक्शन ऑफ स्पाइनल कॉर्ड, ब्राउन सिक्वर्ट सिंड्रोम याद रखना, हाँ, एंड सिरिंगोमाइलिया. ये तीन चीजें, सिरिंगोमाइलिया, ब्राउन सिक्वर्ट सिंड्रोम एंड टेबिस डॉर्सालिस. दिस थ्री थिंग्स यू हैव टू रिमेंबर फॉर द स्पाइनल कॉर्ड. ग्रे मैटर व्हाइट मैटर पढ़ लेना ऑफ द स्पाइनल कॉर्ड. Fine. The various tracks you can remember that. वो physiology में भी हो जाता है. The ascending and descending tracks. हाँ, ascending tracks में spinothalamic याद रखना, spinocerebellar tracks याद रखना. Descending tracks में yes, descending tracks में pyramidal tracks याद रखना, the extrapyramidal tracks याद रखना. Where they end, how they control the muscle tone. ठीक है? And ये sections neuroanatomy is a separate table. सेपरेट वाइवा टेबल है न्यूरोएनाटॉमी का. इन योर फाइनल एग्जाम्स वाइवा का एक सेपरेट टेबल होगा जिसमें ऑल द सेक्शंस विल बी केप्ट, द ब्रेन स्पेसिमेंस विल बी केप्ट, द सेक्शंस ऑफ द ब्रेन, द मीडियल सरफेस, द हॉरिजॉन्टल सेक्शंस ऑफ द ब्रेन, the coronal section of the brain will be kept. Everything is asked. So this you should know. Fine. So this is about the important topics of neuroanatomy. बच्चे, you can write the questions जो मैंने आपको दिए हैं. You can send it to me on WhatsApp. मैं access कर लूँगा. I'll tell you what, if anything is needed to be added or no. Right? So that's my Telegram channel. That's my Instagram handle. इसमें important topics I've discussed in the form of a reel, in the form of a question answers. And that's my YouTube channel. Okay. I hope things are clear to all of you. अगर कुछ भी doubt है तो you can send me a message. Keep on watching this videos. List of important topics and short topics we'll discuss. Okay. Thank you so much. Thank you.